Hello, my name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided meditation, nutrition and exercise, how to live a longer, happier, healthier life, my mantra. My website being gianinc.com, gianinc.com, and facebook.com/guided imagery for all our weekly YouTube video health tips. All are welcome as friends on Facebook and other social media. Today we are going to talk about a condition that 20 million Americans suffer from, and that is called phobia. There are also many people in other parts of the westernized world that suffer phobias. And what is a phobia? It is an irrational fear of certain situations, people, animals, etc., and we'll discuss that later. Remember that phobia differentiates itself from fear in as much as fear can be rational. But when there's an irrational fear about certain objects, places, then it becomes abnormal and a phobia. Phobias is a type of anxiety and can be extremely destructive to the sufferer if the anxiety, the phobia, is not treated properly and correctly. There are many, many phobias, and we're not going to mention all of them. Suffice it to say that it could be divided into agoraphobia, which is a fear of being in certain places at certain times. And then there is social phobia, of a phobia of being with people and certain situations where one mingles with people. And then the third one is generalized phobia, a phobia for specific type objects or animals such as spiders and rats and mice, and that an example of that is called a zoophobia. In other words, a fear of zoo, but not just zoo animals. It's zoo meaning animals of various sizes, shapes, forms, bugs, etc. So there are those three different types of phobias, and then within the phobia category, then all different types of phobias develop. And the one most probably that's most commonly known is that of claustrophobia, or a feeling of being constricted in a certain area. And in the medical profession, that is seen very often in patients who have to undergo an MRI. Because those who've had MRIs or CAT scans, the area, especially in MRI, however, the area is extremely constricted. And one has to crawl into the machine virtually with the head or body touching the top of the machine. So that is a form of claustrophobia. And we and many other physicians have seen that patients refuse to go into that confined area. And it's for that reason that certain companies developed what is called the open MRI, where you don't feel so constricted. These various phobias can be extremely destructive to the person. More females tend to suffer from any type of phobia than males. And some of the patients that we've seen can actually be housebound that they are so scared and have such a phobia of just walking outside of their homes and mingling with other people that they become recluses and live a type of hermit type life. There's nothing one can do to prevent it from happening. It's not a learned procedure or a learned fear. It's an inherent severe anxiety within the person itself. Now, for those of you who have heard me talk and give various discussions, I think you are all well aware that we do not feel that taking medication, relaxants, or anti-anxiolytics are the way to go. We prefer a holistic, non-allopathic manner of treatment, and that the best way of doing that is twofold. One, it's called desensitization. What happens in desensitization? The patient is under treatment by a therapist, and slowly but surely they are asked to do certain techniques and movements to try and get them used to the phobia, which is, as I said, an irrational fear. So if they don't want to go outside, for example, we'll desensitize them and say, okay, just come and stand at the door. Open the door to the outside and stand there. And then after they get used to that without symptoms, we say take a few steps onto the porch or onto the street, wherever. And once they do that, then we increase incrementally their return to society. That does help, but oftentimes the anxiety might be so severe that we try to find out what is at the root cause of this. And the only way that that is done is not through counseling, because it doesn't help, is via hypnosis, where we have the patient extremely relaxed and we're able to probe the subconscious mind and thus find the cause of the phobia, what happened during childhood, or as we mentioned before, sometimes a traumatic episode happened when patients were younger and they repress that idea, the thought, because it was too painful. So one has to be very careful when one does hypnosis and probes the subconscious mind, that you don't bring too much to the fore again, because that can be aggravating. It can flare up and worsen the symptoms. So one has to be extremely cautious when one hypnotizes a patient with a phobia or anything psychologically traumatic, that you do it gently and don't bring it to the fore that the patients suffer severe anxiety. My name is Dr. Hillel Mazansky, and I hope you enjoyed learning more about phobias, which is not that uncommon. Thank you for listening. Good day.